Health info. Bringing you well-researched medical information. What is common cold? Common cold is a viral infection that affects the upper respiratory tract. It is also known as upper respiratory tract infection because of the location where the infection usually takes place. However, the infection can also spread to the lower respiratory tract or lower lungs. On an average, a person can get 2 to 3 colds per year. Colds are common and can recur because many viruses cause it. Cold is caused by multiple viruses of the corona or rhinovirus family. Other viruses which can cause cold infections include adenovirus, influenza virus, respiratory syncytial virus, echovirus, influenza virus, and Coxsackie viruses. When the body gets exposed to the virus, the immune system tries to fight it off. The most common method of transmission of the virus is through human hands. A rhinovirus can survive as long as 2 hours on the hands, and up to many days on other surfaces. A person gets infected when they transmit the virus from their hands to their nose or mucous membranes of the face such as eyes. Symptoms of cold. Cold commonly presents with sore throat, cough, sneezing, blocked or runny nose, and headache. Patients may also experience other symptoms such as muscle aches, shivering, pink eye, weakness, low appetite, and fatigue. A cold usually lasts between 7 and 10 days. It is common to mistake a cold with the flu. However, there are ways to tell them apart. The flu symptoms usually appear suddenly, have more intense symptoms that last longer, and include fever and body aches along with other symptoms. There are different stages of cold. Patients in stage 1 may experience sore throats. In addition, they may experience tiredness, fatigue, runny noses, and mucus accumulations. A person may go about their daily activities during this stage, despite the annoying symptoms. One can, however, tell if a cold is approaching because of past experiences. Symptoms may worsen in stage 2. Aside from runny nose and congestion, the patient may feel tired and suffer mild aches and pains. Sneezing, sore throat, and coughing are also common, and the patient may feel very tired. This stage usually lasts for 2 to 3 days. In stage 3, people usually recover for 7 to 10 days, depending on their immunity. Symptoms may start to improve, and the person may resume regular activities. It is possible for some colds to take longer and to develop complications, such as pneumonia, acute bronchitis, bronchiolitis, croup, otitis media or middle ear infection, and strep throat. Colds are more likely to affect some people than others. Colds are more likely to affect young children, the elderly, and those with weak immune systems. People are also more likely to catch a cold during the winter season. Finally, coming into contact with someone with a cold may increase your chances of catching it. The recovery time from a cold is longer for patients with chronic lung conditions, such as chronic obstructive pulmonary disease, which include emphysema or chronic bronchitis. How can colds be prevented? The following are some common methods for preventing colds. Whenever possible, stay away from anyone who has a cold. Eat fruits and vegetables for a healthy diet. Sneeze or cough into a tissue, then carefully dispose of the tissue into a waste paper basket, and immediately wash your hands. Make sure you wash your hands for at least 20 seconds with soapy water. Do not touch your face, eyes, nose, or mouth. How can you treat a cold? Since colds are caused by many different viruses, there is no medication that can reduce cold duration or fight colds. Medicines, however, can help improve symptoms. Among them are painkillers like ibuprofen and acetaminophen, nasal decongestants and sprays, Cold remedies such as zinc, vitamin C, echinacea, and ginger tea. Herbal products such as primrose, thyme, and eucalyptus. How do I take care of myself if I get a cold? Drink plenty of fluids such as soups, water, and tea, as people run the risk of getting dehydrated. Get plenty of rest. Some over-the-counter medications can help in relieving cold symptoms. Steam can help decongest the nasal passages and help you breathe better. Use salt water for gargles to help with the sore throat. You may need to consult your doctor if your cold does not improve. Consider visiting a doctor if you have any of the following: a cold lasting more than 10 days, a child under 3 months of age who is becoming very slow and tired, symptoms are becoming worse or are presenting worse than usual, the person has a high-grade fever. In case of complications or worsening of symptoms, contact your physician. Keep watching our videos to learn more about cold and other seasonal infections. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.